Guys, hear this from your doctor. Feeling okay is not proof of safety. HIV does its worst damage when it is silent. So many cases are found after years of immune loss. By late 2024, 40.8 million people were living with HIV worldwide, with 1.3 million new infections and 630,000 deaths in 2024, per UNAIDS and WHO. 53% of people living with HIV are women and girls. Men and boys are 47%, and 65% live in the WHO African region. I'm Dr. James, a urologist with 2 decades in HIV and men's health. Today, I'll explain the silent stage, subtle warning signs, a testing timeline, what UU means, and a 30-day plan. If this helps, please subscribe. One subscription from you genuinely motivates me. We're aiming for our first 1,000 so we can keep delivering practical, stigma-free guidance that helps patients and people at risk live with confidence. If you are sexually active, have new or multiple partners, or experienced any potential exposure yet feel well, this message is for you. Educational only, not a diagnosis. Use the 3 to 4W 6W 3NM testing schedule, particularly after risk. Please, carefully. Give me 1 minute to explain this silence, and every second you spend with me fuels my mission to keep creating life-saving education. The silent stage is clinical latency. It often lasts 2 to 10 years or longer. During this period, HIV keeps replicating at low levels. CD4 helper cells decline slowly. Many routine checkups still look normal. People feel fine yet remain infectious. Silence misleads patients and partners. It also misleads clinicians when history is incomplete. You may work, train, love, and laugh while the virus steadily erodes immune defenses. That is why waiting for dramatic symptoms is dangerous. Absence of symptoms is not evidence of safety. Here is what matters biologically. The virus integrates into host cells. It establishes reservoirs in lymph nodes and gut tissue. The immune system compensates for a long time. Lab markers may drift only slightly. Meanwhile, transmission can still occur, especially without protection and testing. Because latency can be long, timing matters. Use a stepwise testing plan after potential exposure. RNA or P24 at 3 to 4 weeks. Repeat at 6 weeks. Confirm at 3 months with a 4th-generation test. Early detection links you to care, treatment, and UEU. Remember, you can pass HIV even when fever, rash, and weight loss are absent. Viral load fluctuates. Condom use, testing with your partner, and retesting reduce missed infections. If you stopped protection after a single negative test, you may have tested too early in the window period. Please align actions with evidence. Disclaimer: with respect. Bodies differ in lifestyle, diet, workload, and rest. Everything I share is health education, not a diagnosis or a prescription. If you plan to add medications or supplements, see a clinic first. Get evaluated, then personalize a safe plan. Why do we overlook the small warnings? Give me 1 minute and you will see why. These 4 reasons appear in men every day, even in those who never considered HIV symptoms. Please do not skip this part. If it helps, leave a comment and tell me. Reason 1. Misreading the window period. You test too early, receive a negative result, and feel safe. Antigen or RNA may not be detectable yet, and antibodies often take longer. A false sense of security follows, protection stops, and exposure continues. Reason 2. Symptom overlap hides the truth. Fatigue, night sweats, recurrent mouth ulcers, skin rashes, and mild weight loss get blamed on stress, flu, iron deficiency, or overtraining. You treat the label, not the cause. The pattern is missed because each episode seems ordinary. Reason 3. the looks healthy halo. A partner appears fit, energetic, and responsible, so you equate appearance with safety. That is a cognitive shortcut, not medical evidence. Testing status and timing matter more than how anyone looks or feels. Reason 4. Stigma delays action. Fear of judgment, privacy concerns, and clinic anxiety push testing to next month. Delays turn weeks into years. By the time symptoms are obvious, immune damage is deeper and partners may have been exposed. Doctor's guidance you can act on today. If you had a potential exposure, schedule testing, then repeat on the correct timeline. Use condoms with new or multiple partners until both of you test according to schedule. Pair testing with honest conversations about the last test date and results. Key reminder before we move on. Feeling well is not proof. A single negative test is not a final answer if timing was wrong. Listen to small clues and align your plan with evidence. These are the whispers your body has been sending. Do not stop. In the next 60 seconds, scan yourself and the people you love. As your doctor, I want you to notice the quiet things your body says when you are busy. These are not dramatic emergencies. They are low-volume signals that fade. Persistent light fatigue. You sleep, you eat, you hydrate, yet the background tiredness remains. It does not knock you down, but it steals focus and drive. Men call it stress, overwork, or an extra late night. Night sweats that come and go. You wake damp on random weeks without fever or flu. Bedding changes fix the night, and the next week seems normal again. Because it disappears, you decide it was nothing. Small rashes that resolve quickly. Tiny patches show up, itch lightly, and heal before you photograph them. They are easy to dismiss as heat, detergent, or friction. The pattern matters more than each single spot. Recurrent mouth ulcers. Aphthous-type sores reappear on the inner lip or cheek. They are painful for a few days, then vanish. Weeks later, they return, and you blame coffee or biting. Unintentional slight weight loss. Pants fit looser though your routine is unchanged. You tell yourself it is improved discipline. Yet no logged plan explains the difference. Tender lymph nodes in the jawline, armpit, or groin. Not overtly painful, just a fullness or ache. It waxes and wanes, so you postpone evaluation. Holidays, deadlines, and travel make postponement feel reasonable. 2 rules help you interpret these whispers. First, repetition counts more than intensity. Second, clusters matter more than single events. A small sign that repeats across weeks deserves a clear plan. Here is how to self-audit without anxiety. Open your calendar for the last 3 months. Mark the weeks with any of the items on this list. If you find a repeating pattern, do not argue with the data. Next, check the risk context honestly. Have you had new or multiple partners? Have you stopped condoms after one early negative test? Do you know your partner's last testing date and type? Now convert a worry into action. Book testing on a timeline that matches the window period. Use RNA or P24 at 3 to 4 weeks after possible exposure. Repeat at 6 weeks, then confirm at 3 months with a 4th-generation assay. While you wait for results, reduce transmission risk decisively. Return to condoms with new or multiple partners. Avoid sharing devices that can draw blood. If symptoms escalate, seek clinic review rather than self-treating online. One more professional perspective. When I review missed diagnoses, the story is rarely one dramatic symptom. It is a collage of whispers spread across months. Patterns predict risk better than isolated events. You are not fragile. You are responsible. A calm checklist outperforms worry every time. Let data lead, let science guide, and let care connect you to confidence. When should you test, and how should you test to avoid missing it? Congratulations on reaching the practical part. Please take notes. This protocol is widely recommended in current medical literature. First, the SMART testing timeline converts uncertainty into a plan. At 3 to 4 weeks after a potential exposure, use HIV, RNA, or P24 antigen testing to detect early infection before antibodies fully develop. At 6 weeks, repeat testing to capture cases that were below detection earlier and to verify a declining risk when the first result was negative. At 3 months, perform a 4th-generation antigen antibody test to confirm status. This anchors your decision about stopping precautions or initiating treatment. Add an STI panel: syphilis, gonorrhea, chlamydia, since co-infections raise inflammation and risk. If exposure occurred within 72 hours, ask urgently about PEP. For ongoing risk, discuss PrEP with your clinician as part of prevention and follow-up appointments. Second, pair testing with a protection pack. Always use condoms with new or multiple partners and treat condoms as default until both partners test negative on the correct schedule. Adopt dual testing before stopping condoms. You test, your partner tests, and both of you confirm timing matched the window period. Schedule a retest every 3 to 6 months if you remain sexually active with new or multiple partners or if status is uncertain. Understand, UQU, with consistent antiretroviral therapy and confirmed undetectable viral load, sexual transmission does not occur. UQU is powerful, but it relies on adherence, regular monitoring, and honest communication about results. Third, reduce transmission risk while waiting for results. Use condoms consistently. Avoid sharing items that can draw blood, and seek prompt care if you develop acute symptoms such as fever, rash, or sore throat in the weeks after exposure. If you miss a testing appointment, reschedule immediately rather than waiting for the next cycle. Fourth, use documentation to remove guesswork. Write the date of exposure, the test type, and the date you will repeat. Keep screenshots or clinic printouts. Documentation prevents timeline drift and supports accurate counseling if you see a clinician. Fifth, build the conversation habit with partners. Ask, when was your last HIV test and which type? Then share your own dates. Most misunderstandings disappear when dates and test types are stated plainly. If this is clear, comment "Understood." If anything is unclear, leave your question and I will explain further. Now I will show why these milestones are reliable and how the biology supports each step. Here is the scientific core, distilled into 90 seconds of plain clinical language. After exposure, viral RNA rises first, often within 10 days. P24 antigen follows, detectable around weeks 2 to 4. Detectable antibodies usually lag, building through weeks 4 to 8. 4th-generation assays look for both P24 antigen and antibodies. That dual target improves early sensitivity compared with older antibody-only tests. It narrows the window when infection exists but antibodies are still maturing. Why the 3 to 4 week test? Because RNA or P24 can appear early, revealing infections before seroconversion. A negative here lowers concern but is not final. Why repeat at 6 weeks? Some people seroconvert later and early antigen may have declined. The 6-week check catches delayed antibody formation and confirms trajectory. Why confirm at 3 months with a 4th-generation test? By then, nearly all infected individuals have detectable markers. Confirmation anchors decisions about precautions, disclosure, or treatment. Now to the transmission logic. Viral load tracks risk. Higher RNA means greater likelihood of passing the virus. This is also why undetectable equals untransmittable when ongoing monitoring is consistent. Retesting defeats false reassurance created by timing. An early negative can reflect biology, not true absence of infection. Scheduled second and third tests convert uncertainty into evidence. Cofactors matter biologically. Sexually transmitted infections raise inflammation and recruit target cells locally. That can increase acquisition and transmission despite minimal symptoms. Laboratory tools have limits, but trends are powerful. Use the same methods to compare like with like. Document dates, methods, and results so clinicians read the pattern. The humane takeaway is simple. Biology runs on a clock, not on hope or appearance. Follow the clock, and it will protect you and your partners. Now, let's see how this timeline plays out in real patients. In 2025, I reviewed 2 anonymized cases that illustrate why feeling fine misleads men and partners. Lisa, 29. She donated blood for a friend and received a callback 2 weeks later. Screening flagged HIV. Her confirmatory workup showed a CD4 count already below 300, yet she had felt completely healthy. She had occasional mouth ulcers and mild night sweats, which she had blamed on stress. When we traced timing, the likely exposure was years earlier. She had never tested because she appeared well, and annual checkups were normal. We started antiretroviral therapy immediately, arranged partner testing, and built a follow-up plan. Within months, her viral load became undetectable, and she regained confidence and routine. Kenvil, 38. He came to clinic for fatigue and an unusual pneumonia. He thought he was simply getting older. Testing confirmed HIV. His immune system was in crisis, and he did not know. We stabilized the pneumonia, initiated treatment, and educated him about UU and retesting for partners. Kenvil had stopped condoms after a single early negative test years before. He had never repeated testing on the recommended schedule. That timing error delayed detection and allowed silent immune decline. The lesson is direct. Feeling well is not proof of safety, and a single negative test is not the final answer if timing was wrong. If this message helps you act, comment "scheduled," so I know you have booked your next test. Stay proactive between tests. Here is the 60-second C-Sense scan routine I give patients. If you are not in these risk groups, please share it so friends and family can lower risk safely. C. Look at the last 90 days. Mark any weeks with fatigue, night sweats, mouth ulcers, small rashes, unintentional weight loss, or tender nodes. Note any new or multiple partners, breaks in condom use, or early single tests. Sense. Ask how your body feels today compared with last month. Are the whispers repeating or clustering? If yes, treat that pattern as data, not anxiety. Decide whether the timing matches 3 to 4 weeks, 6 weeks, or 3 months after possible exposure. Scan. Book tests that match the window period. Use RNA or P24 at 3 to 4 weeks, repeat at 6 weeks, confirm with a 4th-generation test at 3 months. While waiting, restore condoms, avoid blood-drawing items, and schedule partner testing together. This routine changes more than lab numbers. Anxiety drops because you have a plan. Trust grows in relationships through dual testing and shared dates. Preventive care becomes normal. Vaccines, STI panels, and retesting. That shift is the emotional rebirth I want for you. You move from passive worry to active stewardship. Call it a second springtime. Clarity returns, confidence rises, and choices become kinder to you and your partners. If you are outside these scenarios, amplify the message. Your share may be the reason someone tests on time. We will close with a practical 30-day plan you can start today. Week 1. Book testing and baseline screening and risk counseling. Schedule HIV, RNA, or P24 testing if exposure was within the last month. Add an STI panel for syphilis, gonorrhea, and chlamydia. If exposure occurred within 72 hours, ask urgently about PEEP and follow up. Week 2. Set your protection pack and shared rules. Use condoms with new or multiple partners as default. Discuss PrEP if ongoing risk exists. Test together before stopping condoms and confirm timing matches the window period for both partners. Week 3. Track the whisper list with a weekly check-in. Note any fatigue, night sweats, mouth ulcers, small rashes, tender nodes, or unintentional weight loss. Patterns matter more than single events. If items cluster, move your retest earlier rather than later. Week 4. Retest and lock-in reminders. Use a 4th-generation antigen or antibody test at 3 months for confirmation. Create calendar alerts for retesting every 3 to 6 months. Keep copies of results and dates so the plan stays clear. While waiting for results, lower risk decisively. Use condoms consistently. Avoid sharing blood-drawing items. Seek clinic review if acute symptoms escalate after exposure. Clarity beats worry when you follow the clock. Please share this video with one person who might need it today. Subscribe to receive the downloadable checklist and automated testing reminders. Leave a comment that says "helpful" or "needs improvement" so I can refine the guidance for you.